Hey everyone, today we're taking a look at the shoulder joint here and we're going to explain what is bursitis. We've had a lot of people asking what it is, so let's go ahead and explain it. So you take a look at the shoulder and you have this arm bone here, the humerus, the biceps tendon here, which runs along there. You have the clavicle and you have the acromion, which makes up the AC joint, and you have the rotator cuff, this bulk of tissue here that really keeps our shoulder still and stable in the joint. And if you were to take this rotator cuff out and take a look underneath it, you can see something called the subdeltoid bursa. Basically, it goes in between the bone and that rotator cuff to decrease the friction and kind of give it a smooth surface so it's not rubbing bone on muscle. What happens is a lot of people get very tight in the shoulder from poor posture, from sitting a lot, or from weightlifting a lot of heavy weight overhead. And what happens now is the shoulder kind of moves upward in that joint and forward like this. And what happens is now that bursa, every time someone goes overhead, is you're actually going to go ahead and compress it into the roof of that shoulder. So that bursa likes to get very inflamed and swollen. So a sign of bursitis is if you have a massage or you have some treatment and your shoulder pain gets worse, most likely there is an irritation to the bursa, and you want to make sure you're addressing the inflammation of the bursa and not doing too much deep compressive therapy. So sometimes it's trial and error. If you've had treatment somewhere and it got worse, very much could be that the bursitis is the main source of the pain. So if anybody has bursitis, we treat it very effectively in our office. If you have any questions, feel free to email us about it. Have a great day.